For several decades now, airline pilots have been required to use a checklist to ensure all systems are go prior to takeoff and landings for every single flight.
Simply put, flight crews don't leave the preparation for flight to chance or rely on memory. To ensure their safety as well as the safety of their passengers, the crew follows a well-defined checklist which clearly delineates items that must be done before the plane leaves the ground and again before it lands.
The healthcare industry has come to appreciate the benefits of such an approach and is increasingly turning to the use of checklists to improve safety in the hospital setting.
Here in the operating room, we have developed a process which incorporates a checklist for use by our OR teams that will ensure the delivery of safe, consistent, quality patient care. We will also examine the three components of the checklist, namely pre-induction, timeout, and sign-out. Of course, prior to taking these steps and bringing the patients into the operating room, it is important to ensure that all required surgical implants, supplies, and specialized equipment are available and in good working order.
Okay, Constance.
1. Pre-induction. Upon room entry, attach consent form and checklist to the timeout board. Introduce the patient to the team. Read the procedure to be performed from the consent form. State if the patient has any allergies.
This is Jennifer Bell. We're going to be doing a left inguinal hernia repair laparoscopically, and she has no allergies.
Until now, we didn't have a uniform process for the preparation of our patients in the operating suite, thereby increasing the possibility of error. In this video, we describe and illustrate the mechanics of using the surgery checklist in a practice setting.
Timeout.
2. Timeout. The timeout should be done immediately prior to incision, after the patient has been prepped, draped, and readied for surgery. It is vital for all team members to be attentive during the timeout. All other activity should cease. The timeout has a recitative component which includes reading the patient name and date of birth, as well as the name of the planned surgical procedure, specifying site and side if applicable. There is also an interactive component, which includes the nurse's confirmation of indicators checked and the anesthesiologist's confirmation that antibiotics have been given if indicated. The surgeon then confirms that all is in order and that there are no other issues regarding the procedure. Final approval is given to start the procedure and all is good to go.
This is Jennifer Bell, date of birth October 2nd, 1956. We are doing a left inguinal hernia repair laparoscopically by Dr. James. Nursing, have indicators been checked? Yes. Prep's dry. Bovisection and compression stockings have all been turned on. Dr. Dockweiler, have antibiotics been given?
Yeah, 1 gram of Vancef's in.
And Dr. James, do you have any issues?
No issues.
Are you good to go?
Good to go.
Okay.
Thanks, everybody. Great job. Thanks very much.
Here you are, Dr. James.
3. Sign out. Confirm with the surgeon. Surgeon will sign out with the circulating nurse. At that time, the nurse will notify the surgeon that counts are correct, confirm the procedure name, and if applicable, confirm that a receipt has been received from the lab for any specimens sent. Finally, make sure the preference card is correct. If not, make changes and attach the corrected card to the checklist.
Your counts were correct?
Thank you.
And what was the name of the procedure?
Left inguinal hernia repair.
Okay, and was your preference card all right?
Indeed, yes.
Okay, thank you very much.
When sign out has been completed, return the consent form back to the chart and return the completed checklist to the collection area.
As we all know, no matter how skilled we are in our practice, being human, sooner or later, we will make a mistake. That's why it is important that the steps outlined in this video and on the surgery checklist are followed to the letter for every surgical patient, every time. This highly scripted process will enable you to reliably deliver care to your patients in the safest manner possible, while at the same time greatly reducing the possibility of serious omissions and mistakes.
The Surgical Safety Checklist represents a simple set of surgical safety operating room standards. This checklist is not intended to be comprehensive. Additions and modifications to fit local practice are encouraged.